Good morning, Dr. Ishika Agarwal. My name is Mohammed Sulaiman Hadi, and I am a grade 5 student. As a part of my community hero project, I would like to interview you. Thank you for giving your time into this interview.
Good morning, Mohammed Salman Handi, and I'm very, very grateful to have you with me today.
Please introduce yourself. Tell us what you do and how long you have been doing it.
I'm Dr. Ishika Agarwal. I'm a general dentist. I've completed my Bachelor of Dental Surgery from College of Dental Sciences, which is in Karnataka. After completing that, I've been associated with Dental World Super Specialty Clinics located at Kolkata, India. I've been practicing here for the last 1.5 years as a general dentist.
Mm. What inspired you to become a dentist? What was your childhood dream and how did you reach your goal?
Okay, a very interesting question, something that I keep wanting to tell youngsters of today's generation. When I was a kid, a lot of people told me that my smile is very nice, and I always used to get compliments for how I laugh, which is why I thought that if I want to become somebody who wants to do social service, because I, from the very beginning, did not want to go into finances, I always wanted to go do something for the society at a large scale. So I thought that why not impart that smile? Why not have patients who go back healthy with happy teeth and who can smile as happy as I am being able to with a healthy set of teeth, which is what motivated me to become a dentist.
Yes. What is an average day at work like? What dental problems do children often come with? And what are the solutions?
Okay, so very good question. Throughout our practice day in and out, we see kids of all age groups. We see kids who are right from 1 year of age to kids who are elderly also. The most common problems that we see right now, more than cavities, more than pain, more than teeth pain and all of that, is a lot of habits that children have in their phase of growth. Habits including mouth breathing, tongue thrusting, lip biting, or pacifier sucking. A lot of such habits are something which children have, and they constantly grow with these habits. Now, the problem is that parents and children do not realize at that point in time that these habits could eventually lead to a lot of problems in children. And therefore, these habits get neglected. So, there is a major void, which is lack of awareness in parents that these habits have to be corrected at the correct age, or else it can lead to a lack of development of orofacial musculature, alignment issues, bite problems, and a lot of other things that the patient will have to suffer from. So I think that's the biggest challenge which we face. More than convincing the parents for the treatment, convincing them that this is very important for your child and making them aware that these are the consequences is something that's very crucial in today's time.
You mentioned orofacial treatment. What is that?
Orofacial treatment means that we have muscles in our jaw that holds our lower jaw, which is the mandible, together. These muscles have to be always in the most relaxed state so that we have a very comfortable bite and we don't feel stressed in our joints. We can sleep comfortably. Patients who do not have a correct bite, who have habits that put that they keep thrusting their tongue or they mouth breathe or thumb sucking, they have a higher palate, they have a larger tongue, because of which these muscles get constantly stressed. That eventually leads to a lot of joint issues in future. So our orofacial musculature is something that's a very big determinant of a good and healthy lifestyle.
How do you help people through your work? Why do you feel dental health is important for children, and how do you help nervous children?
Very good question again. So, how do we help nervous children? I first want to start with that. We have patients who come in, and some of them are very excited for their treatment and very enthusiastic, not fearful. But there is a large chunk of kids, because obviously dental anxiety among kids is very common. What we do here is we use treatment methods first, like behavior modification. We make the kids and the parents understand the importance of the treatment and how the entire process is going to be completely painless. We reassure them and give them all proper pre-instructions that they have to follow with the child before bringing them to the appointment. First thing is making them psychologically prepared for the appointment. And that really works for a lot of people. After which, if we see that they are still not very prepared for their appointment, we then go ahead with techniques which involve sedation, conscious sedation through nitrous oxide gas, that really helps in calming the kid down, allowing us to effectively work on him. These are a few of the ways we try to calm nervous patients. And you would ask me one more question. That was what?
How do you help the community through your work?
Yes, and how do you think dental health is important for children? Yeah. So what I feel is that through our work and through imparting the knowledge of importance of dental care, we are able to imbibe a habit in children from the very young age, which is very important. Treatment is a completely separate aspect, but imbibing the knowledge of taking care of your oral cavity from the childhood is important so that when they grow up and become adults, they have already learned the basics of taking care of their oral health. Like simple things like brushing daily twice, simple things like using a flosser or an interdental brush, cleaning their tongue. If these things are taught from the beginning, it really plays a very major role in adulthood.
Yes. What has been your biggest challenge? What do you enjoy most about this? And what makes you feel proud?
uh, then we do face a lot of, I wouldn't say challenges in particular, we do face a lot of tough instances throughout our day of course. And I think the biggest challenge and the biggest void I feel, like I mentioned previously also, is that people really have a lot of dental neglect, meaning that they feel that as long as there is no pain, everything's okay. And they always want to wait for pain to come and then go to their dentist. That's a very big void in dental health right now in India. We should not go to a dentist whenever we are in trouble. We should rather, like a routine visit, go to a dentist every 6 months to get ourselves checked that whether we are in the correct thing or not, so that there shouldn't be any point in time where the problem has happened and now we want to cure it. So I think prevention is better than cure is something that needs to be followed.
What three simple tips would you give children to improve their dental health? And what advice would you give someone who aspires to become a dentist?
Okay. So three simple tips that I would give to the children are: number one, brush regularly and keep your oral cavity clean as much as you can. Second, visit your dentist. Do not be afraid of them because they want the good for you. And third would be, if you have any habits and you feel that you are doing something which is different from kids around you, do tell them to your parents, and your parents must take you to your dentist. This is the three habits that I would want to give to the children.
And what advice would you give someone who aspires to be a dentist? You are on mute, ma'am.
Hello.
Yes, so what advice would you give someone who aspires to become a dentist?
So I would like to tell, there are a lot of things actually. See, I would like to tell the children that dentistry is a wonderful field. Dentistry is something where you are actually being able to closely meet people in their truest forms. And when you smile, your teeth are visible, and patients are very conscious about that. So when somebody is coming up and telling you about their oral health and their problems, means they're really confiding in you. So for me, becoming a dentist and aspiring to become a dentist is a lovely profession, and I think you should 100% opt for it if you have the zeal for it.
Today, I learned that being a dentist is not just about treating teeth, but helping people and making them feel comfortable. I really enjoyed learning about your journey and the work you do for the community. This interview has inspired me to understand that with hard work, dedication, and care, we can make a difference in others' lives too. Thank you for taking this interview.
Thank you so much. Take care. Thank you, Sulaiman. Thanks.